Shared decision-making. In the traditional doctor-patient relationship, the doctor is the expert and tells the patient what they should be doing. The patient's role is to follow what the doctor believes is best. But it's now known that if a person is not included in deciding about their care, behavioral changes are not as likely to occur. Shared decision-making, in contrast, is a collaborative process that involves a person and their healthcare provider working together to make decisions about treatment and care. When there are options and no single right answer, instead of telling a person what to do, share the decision-making. Here's how it works. First, get to know the patient as a person. Showing genuine interest in the person is important in developing rapport and trust. Invite participation. Share the lab results with the person. You tell Roshan that most of his lab tests are normal, but his blood sugar has been too high lately. Is he willing to talk about how he is managing with his diabetes? Roshan admits that he loves sweets. He always puts 3 spoonfuls of sugar in his tea. He has been drinking soda and snacking more often at work. He also doesn't get much exercise. Present the options. You tell Roshan that he is now taking the highest dose of metformin. He has 2 options. 1, he can add a new medicine, or 2, he can make changes in what he eats and get more physical activity. Provide information on benefits and risks. You tell Roshan that diabetes tends to get worse over time. There is no single right answer for the next steps. It depends on what he is willing to do. Explain his choices in a way he can understand using clear, simple language. The new pill is in the class called sulfonylureas. It will likely help lower his blood sugar, but he may gain weight and his blood sugar can be too low occasionally, so he will need to learn how to treat low blood sugar. Or he can reduce the sweets and get more exercise. That would help to improve his overall health and may bring his blood sugar under control. He needs to be motivated and maintain the changes. But if he can do that, lifestyle changes have much more impact than any medication you can give him. Help the person evaluate options based on his own goals and concerns. Ask Roshan if he has a preference. He explains that he had never heard how lifestyle changes really compared with medication. He is impressed by the power of eating better and exercise. He's very reluctant to take more medicine and especially doesn't want to gain weight or worry about low blood sugar. For the next 3 months, he'd like to try reducing sugar in his tea, eating healthier snacks, and walking during his lunch break. Facilitate thoughtful decision-making. You reflect back. What I'm hearing is that you are reluctant to try this new medicine due to the side effects. You'd rather improve your eating habits and get more activity. I agree this is a good decision for you. Assist the person in following through on the decision. You tell Roshan that you'll check in with him in a few weeks by phone. Then see him back in 3 months for a blood test and follow-up visit. Remember, sharing decision-making with the person with diabetes promotes trust, confidence, and more participation in their health. This leads to better health outcomes.